what happened next regarding the chemotherapy?
Right, I started my chemotherapy. I was very, very nervous, very, very anxious. The thought of having the chemotherapy made me quite ill, actually. Out of all the treatments that they were giving me, I really had a thing about not having it, you know. I really didn't want it. I had my first lot, and I think it just went on how it was supposed to. That they explained what would happen and at the different weeks that you go through with it. But when I came to have my second lot, my blood count was too low for it. So I had to start having injections to boost my immune system.
Yep.
So that I could carry on having the chemotherapy. So they just took the bloods, and as long as my immune system was, the levels were high enough, I could carry on with it. But the second one I had absolutely wiped me off my feet, and it made me very, very poorly. I went back to the oncologist, and he was asking questions, and he said, I think we need to stop this because the
side effects
are outweighing the benefits.
Yeah. Did you agree with that? Because that's a difficult decision.
It was a very, very difficult decision, and the problem is it wasn't my decision. And I did say to him, I'm frightened because, you know, I'm not getting all my treatment.
Exactly.
You know, it was very, very frightening.
Yeah. Because you probably wanted to complete.
I did. I wanted to complete everything they offered.
And what did he say to that?
What he suggested was that they ablate my ovaries with radiotherapy, which would stop them working because my cancer was estrogen positive. Then it would stop the flow of estrogen.
Yes.
And that, in effect, would be the same benefit as having the chemotherapy.
Yes.
So, although I was a little bit nervous about it because I still hadn't had the chemo, eventually I sort of managed to live with that. And then I went on to the radiotherapy. I had 25 sessions, which you go for Monday to Friday. And I had radiotherapy to my armpit and the area of mastectomy. The most that happened with the radiotherapy is obviously you feel very, very tired with it. And I look like I've got a nice big patch of sunburn. I blistered quite badly towards the end, but they give you plenty of things to combat that, you know, creams and things. But generally, I tolerated the radiotherapy very well. And then I was given 5 years of tamoxifen. And after that, the oncologist said that they would put me on another drug after the 5 years. I think, I'm not 100% certain, it's called Letrazole.
Anastrozole, is it?
Is it anastrozole?
Or is it Letrazole?
I think it's Letrazole. I'm sure it was an L.
It could be.
But that helps to guard you for another 5 years.
Yes. And did you have that procedure for the ovaries that you mentioned?
I did have that procedure for the ovaries. Unfortunately, it's caught my bladder as they were doing it.
Was it radiotherapy they were targeting?
Yes.
So there was a little bit of overspill to the bladder.
I think, yeah.
And what was the side effect you got?
Unfortunately, incontinence.
And that definitely came from that, did it?
Yes.
Did they warn you about these side
They
effects?
did, yes, they did. But to be honest, I'd rather have had my ovaries stop. The incontinence side of things is not, it's not pleasant, but it's not a major issue, and things can be done.
Yes.